what is the definition of sudden cardiac death in athletes? See, actually the definition varies. According to one definition, only deaths occurring during exertion or shortly after exertion, that is less than 1 hour after the exertion. Or according to the second definition, any sudden cardiac death in an athlete, that is whether it may be exertional or outside the exertion, or also episodes of sudden cardiac death, resuscitated sudden cardiac death. So this is the second definition. If you see the general definition of sudden cardiac death, death due to instantaneous unanticipated circulatory collapse occurring within 1 hour of initial symptoms. According to the World Health Organization, sudden collapse occurring within 1 hour of symptom. So the sudden cardiac death in athletes is the most frequent cause of medical death in this subgroup. The incidence varies from 1 in 40,000 to 1 in 80,000 athletes per year. So we all know that exercise is one of the most powerful tools for improving the health and also for producing beneficial changes in most of the cardiovascular risk factors like diabetes, hypertension, dyslipidemia and obesity. And we also know there is an association between the moderate aerobic exercise and the decreased risk of coronary artery disease and death. So we should also remember that exercise can be associated with the risk of sudden cardiac death in certain people who harbor certain cardiac condition, and this is called as an exercise paradox. So sudden cardiac death in young athletes represent an important and emotionally charged public health issue, and it brings to the forefront the many gaps in knowledge regarding prediction and prevention of these tragic events. Nearly 100 to 150 deaths during competitive sports occur in the US every year, and 3,000 to 5,000 sudden cardiac deaths per year in the US population between year 1 and 19. Competitive athlete dies once in 3 days in US. Who is a competitive athlete? The competitive athlete is one who participates in an organized team or an individual sport that requires competition against others as a central component. So people think the athlete die because of what is called as the athlete heart. See, it is not so. It is a constellation of structural and functional changes which occur in the heart of people who train for prolonged duration, maybe more than 1 hour for most of the days, and or frequently at high intensities. So that is the endurance athlete, those who go for running or swimming or cycling for a long duration every day. And what are the signs of athlete heart syndrome? The signs include they will have a sinus bradycardia, systolic murmur, and abnormal heart sounds in the form of S3 and S4. And if you take an ECG, they will have definitely abnormalities in the form of sinus bradycardia, first degree AV block, then type 1 second degree AV block, and also left ventricular hypertrophy is common. And diagnosis of athlete heart is usually clinical. Sometimes you may need the aid of echocardiography or sometimes cardiac MRI. So we should also remember how to differentiate between athlete heart and patient with cardiomyopathy. If you see take the left ventricular septal thickness, especially in men it will be less than 13 millimeters, and in women it will be less than 11 millimeters in athlete heart. Whereas if you take the cardiomyopathy, the thickness will be more than 15 in men and more than 13 in women. And if you see the left ventricular end diastolic dimension, it will be less than 60 millimeters in athlete heart, whereas it will be more than 70 millimeters in those with the cardiomyopathy. Diastolic function, if you see, it will be usually normal in patient with athlete heart, because if you see the E by A ratio will be more than 1. Whereas if you see the cardiomyopathy patient, they will have always abnormal diastolic function. Maybe the E by A ratio will be altered, and usually it will be less than 1. And if you see the septal hypertrophy, it will be symmetric in athlete heart, whereas in patient with cardiomyopathy, it will be asymmetric. And usually the family history won't be not nil contributory in athlete heart. It may be present in patient with cardiomyopathy. What is the response to exercise? Especially the response to exercise, the BP response to exercise will be normal in athlete heart, patient with athlete heart, whereas in cardiomyopathy, it will be normal or it can be a reduced systolic blood pressure response to exercise. So deconditioning, what is deconditioning? That is, if you stop the exercise maybe for a duration of 3 months, usually the left ventricular hypertrophy in athlete heart will regress, whereas this won't happen in patient with cardiomyopathy. So people think that athlete heart is dangerous and it is a reason for sudden cardiac death. It is not so. So athlete heart is not dangerous for athletes, and it is not the cause for sudden cardiac death in athletes either during or shortly after the exertion. So sudden cardiac death occurs in athletes mainly due to the presence of hypertrophic cardiomyopathy or arrhythmogenic RV cardiomyopathy, which is present in the athletes hitherto unnoticed. So no treatment is needed for people with athlete heart, and it does not pose any physical threat to the athlete. So now we will see what are the causes for sudden cardiac death in athletes. Cardiac causes for sudden cardiac death in athletes. So those with the structural abnormalities, the most common cause is hypertrophic cardiomyopathy, then dilated cardiomyopathy. Those with the coronary artery anomalies, this we should suspect. So when there is an anomalous origin of the coronary artery from the aorta, and if it traverses between the aorta and the pulmonary artery, so when these two great vessels engage during exercise, this coronary vessel can get compressed in between the two great vessels, and it can result in ischemia, then malignant ventricular arrhythmia and sudden cardiac death. So another condition is LV non-compaction. Then coronary artery disease is the most common cause of sudden cardiac death in those people who are more than 35 years. And arrhythmogenic RV cardiomyopathy. And we know of late we are seeing more of a malignant mitral valve prolapse syndrome in young people who can die suddenly. So then coming to the structurally normal heart. See, this is otherwise called as a patient with primary electrical disorders or channelopathies. So patient can have a congenital long QT syndrome or acquired long QT syndrome, or they can have a short QT syndrome. Then Brugada syndrome, I think morning doctor he was talking about Brugada syndrome. That is also another important cause for sudden cardiac death. Then we have catecholaminergic polymorphic VT and idiopathic ventricular fibrillation. And sometimes even WPW syndrome patients can present with atrial fibrillation with rapid conduction to the ventricle, which can lead on to VT, VF and then death. What are the other causes of sudden cardiac death in athletes? Stimulant use like methamphetamine use, that is another cause for sudden cardiac death. Then anabolic steroid use. And then commotio is another important entity we should remember. One of the cause, the people, athletes suddenly die on the field. So when there is a hit on the object, chest, due to blunt injury, most commonly maybe when they are hit by a baseball, which is a hard object, on the chest of the athlete who has got a thin and compliant chest wall, and when it happens during the vulnerable period of the cardiac repolarization, it can trigger ventricular tachyarrhythmias and then sudden cardiac death. And of course, myocarditis can also lead to sudden death or even aortic rupture. So according to the National Athletic Association, there is an increased risk has been found in athletes with the following conditions, conditions like male gender, black race, and those who are participating in basketball. But actually the mechanism of high risk of sudden cardiac death in athletes who take part in basketball is not very clear, but may be related to the Marfan syndrome, and the resulting aortic dissection may be the reason for sudden cardiac death in them. So this is another, the increased risk group of athletes who are more prone for sudden cardiac death. That is those who are males, black race, and those who participate in football, soccer and basketball. They are more prone for sudden cardiac death. So in Italy and Denmark, they found that the predominant mechanism for sudden cardiac death is plaque rupture or supply-demand mismatch. And the most common cause of sudden cardiac death in young athlete is arrhythmogenic RV cardiomyopathy. Nearly 25% of sudden cardiac death is accounted by arrhythmogenic RV cardiomyopathy. So now we should know how to prevent sudden cardiac death in athletes. So there is a very important role of pre-participation screening test of athletes to evaluate for occult cardiovascular disease, we should take a very good history, including family history, good clinical examination, including auscultation, and we can do basic tests like ECG, echocardiogram, X-ray chest, and cardiac MRI. And when you find one of these conditions, I mean, if you find any abnormal features in the testing, I think we should bar the people from taking part in competitive sports. So a word or two about the ICD. The implantable cardioverter defibrillator is an important life-saving device, and it is very useful in the above conditions, like which are prone for sudden cardiac death. Those with a structurally normal heart or with a structurally abnormal heart, it is a very important life-saving device. And this device was first invented by Dr. Mirovsky, and first human implant was made in the year 1980, and the first FDA approval was obtained in 1985. This is how it looks in a patient after implantation. This is a pulse generator. This is like a pacemaker pulse generator, and this is a ICD lead, and the tip goes to the RV, either to the apex or to the low septum. And there is a coil here, the distally coil. Usually earlier they used to have two coils. Now most of us use only the single coil ICD lead. That is, it will be in the RV, and the shock is delivered between the can and the coil. How does the ICD work? Actually, ICD continuously monitors the patient rhythm 24 hours, and it takes a photograph of the normal sinus beat. And when there is a abnormal rhythm, when the tachycardia happens, then the ICD takes a photograph of the tachycardia beat and compares this beat with the sinus beat photograph and template. And then if the match is less than 70%, it thinks it is an abnormal rhythm. And first it gives a ATP, that is anti-tachycardia pacing. We know that nearly 85 to 90% of even fast VT can be terminated with ATP, avoiding shock. We know the ICD shock, if the patient is very painful, and it can result even the psychiatric disturbances, mentally produce a lot of mental agony for the patient who receives the shock. So we should try to avoid shock, and ATP is a very useful parameter to reduce the shock, and at the same time it can terminate the rhythm back to sinus. Suppose if the ATP fails, then the device gives a shock and then bring back the normal sinus rhythm. So dear friends, to conclude, sudden cardiac death in athletes is the most frequent cause of medical death in this subgroup, and incidence ranges from 1 in 40,000 to 1 in 80,000 athletes per year. And we should remember that athlete heart per se is not the cause for sudden cardiac death in athletes, and it is due to the presence of associated hypertrophic cardiomyopathy or arrhythmogenic RV cardiomyopathy or primary electrical disorders or channelopathy present in the athletes hitherto unnoticed. So the pre-participation screening of athletes to evaluate for occult cardiovascular disease is very important, and it goes a long way in preventing sudden cardiac death in athletes. So I stop here and thank you very much.